Welcome and thanks for joining us for the presentation today. We're going to be talking about anoxic and hypoxic brain injury. This is brain injury or alteration of brain functioning as secondary to an absence of oxygen availability, which is called an anoxic injury. In medicine, anytime you put an A in front of something, it means it is missing or absent. So anoxia means lack of oxygen, or reduced oxygen, hypoxic, lowered amount. And those are typically event or events that can result in changes and alterations of brain function. So first thing is, dry air contains by volume about 78% nitrogen, about 21% oxygen, some trace elements beyond that. Nitrogen has no effect on our body. It is completely inert to us. It has to do with the chemical makeup of the molecule of nitrogen and the fact that it doesn't easily unbond or rebond, and it doesn't react. It's a very stable molecule, and so as a result, it takes a great deal of heat or electrical arcing or sparks for nitrogen to react. Oxygen, on the other hand, is double bonded. It is much more inclined to react at standard conditions, those conditions at which life exists. And air is made up of about 21% oxygen. So about 21% of what you breathe in as you're breathing is oxygen. Now the air that you breathe out, your exhale, contains about 16% oxygen and about 5% CO2. That's why when you perform CO2, when you're performing CPR, you can actually do rescue breathing by exhaling into someone else's lungs because there's sufficient oxygen in what you are exhaling to support life. Oxygen has a molecular capability of oxidation and electron transfer, which is crucial in using substances at a cellular level to create energy. And we're going to talk about that a little bit. I don't want to get way too far off in the weeds, but we have to kind of build at least a groundwork for why oxygen is necessary to begin with and how our body utilizes that. CO2, on the other hand, is a waste product that cells produce as they use oxygen as a catalyst to generate energy. We'll talk about that in a little bit as well. Oxygen is necessary in order for the cells in our body to generate energy. Now, our red blood cells are responsible for oxygen transport through our body. All of our living cells are dependent upon oxygen as a catalyst for the manufacturing of energy. Now, as we'll discuss, and as it's of primary importance to what we're talking about today, our brain requires an uninterrupted supply of oxygen to carry out its role in the human body. And our brain is exquisitely sensitive to any variation in that oxygen supply. As an adult, you've got approximately 20 to 30 trillion red blood cells in your body at any given time. It comprises about 1/4 of the total number of cells in the human body. Actually more if you live at higher altitudes. You have hormones in your body that regulate the production of these red blood cells on the basis of oxygen levels. The primary hormone is made in the kidneys, and thus if you have kidney damage or kidney injury or removal of a kidney, it can result in anemia due to the lack of the hormone that is needed for that red blood cell production. These cells develop in the bone marrow. They circulate around in your body for an average of about 120 days, and then they're programmed to die. They break down and their components can be recycled. This is programmed cell death, and that's an important aspect when it comes to brain injury as a result of lack of oxygen as well. So remember that term of programmed cell death. That's important. When red blood cells age out, they're basically removed by macrophages in the liver and in the spleen. Now, oxygen is taken up by red blood cells in the lungs. About 97% of the oxygen circulating within your bloodstream is carried by the hemoglobin, a protein in red blood cells. About 3% is dissolved in your blood plasma. At an atomic level, each molecule of hemoglobin on your red blood cells contains about 4 iron atoms. That's what gives blood its red color to begin with. Each of those atoms combined with 2 oxygen atoms. So each one of those molecules can carry 8 oxygen molecules throughout your body. And this is a representation of the time it takes for a single red blood cell to complete a circuit within your body. As the oxygen is taken up in the lungs, it's then released as red blood cells squeeze through the body's capillaries, so these very fine networks between arteries and veins allow for the exchange of oxygen and for CO2 in many cases as well to be bound to that red blood cell and to travel back to the lungs where it's re-exchanged. So about 20 seconds is what it takes for a single red blood cell to travel to one of the most distal parts of your body and then the heart back through the lungs and go back out again. This is a representation of a single cell, a nerve cell, a neuron within our nervous system. This one is actually representative of one within our peripheral nervous system, and we know that because the myelin sheath that is represented out here by this blue tube-looking thing on the axon, that myelin sheath is in place there because of a Schwann cell. Schwann cells create the myelin for our peripheral nervous system, whereas in our central nervous system, it's one of the many glial cell types called an oligodendrocyte that creates that wrapping that helps protect and speed transmission down the axon. Within this image, you see the larger red cell body, and within that cell body, probably the most important thing from the standpoint of what we're talking about is something called mitochondria. The mitochondria is the factory that creates energy within the cell. It is what uses fuel within your bloodstream and oxygen within your bloodstream to convert over into energy that the cell can use. The glial cells that surround that neuron are key in the O2 transport. They can actually upregulate or downregulate the amount of oxygen that a given cell might need, and that's based on the demand at any given point. Cells in textbooks are often represented as a single cell body connected to another neuron. In fact, within your central nervous system, neurons typically connect to somewhere between 1,000 and 10,000 neighboring cells. In some parts of the brain, that number actually goes up to around 200,000 neighboring cells. So it's an amazingly rich interconnection of cells. Within this artificially colored image, the numerous bright spots that you see along the branches, the dendrites of the central cell body that represent synapse points. These are places where other cells interact with this cell. So it's an amazingly complex input for the ultimate purpose of determining whether or not this cell fires off a signal to the next cell or cells downstream. Cells are packed together within the outer layers of the cortex, typically 6 to 8 layers deep, somewhere between an 1/8 of an inch to a 1/16 of an inch in depth. And that makes up the wrinkled walnut-looking surface that is typically pictured when you see a representation of the human brain. These rich interconnections involve electrochemical impulses, and the neurotransmitters are released in the presence of the activation of the synapse. So an action potential, which is a chemical and electrical signal, is propagated down the length of the axon, and it releases chemicals. Those electrochemical impulses, those cells connecting via neurotransmitter release and reception, this is how our brains do what they do. All of your complex, simple, basic, automatic actions, as well as everything that you are capable of purposefully doing and being aware of, that is what your brain is responsible for. And it all comes down to energy. It all comes down to fuel. Without the fuel necessary, everything's going to stop. So within your brain, throughout the whole of the brain, that energy is derived in part from the presence of oxygen molecules. And without oxygen, the energy levels needed for the level of functioning is not present. Now, the brain doesn't have the capacity to store oxygen, so it needs a very rich network of blood supply throughout. What you see on these two pages is a good representation of the complexity of the routes through which blood travels to get to the brain. And you have to also keep in mind that what you're seeing here are just those arteries, those major arteries that lie on the outside of the brain. It is equally as rich, if not more so, deep within the brain, where the oxygen transfer must take place in order for things to continue working like they are supposed to. So there's a rich interconnection of arteries, capillaries through which oxygen exchange occurs, and these veins then route the blood back to the heart and the lungs for reoxygenation. Now, your brain uses more oxygen than almost anything else in your body. Your brain makes up about 1 to 2% of your body's mass. It uses between 20 to 25%, depending on the demand at any given point, of the oxygen that you are breathing in. Now, it uses a lot of fuel, and it doesn't have the capability of storing it. So it has to have a continual flow to provide it. And if the supply is cut off, things start to happen very quickly. Now, if you take a cord, I don't recommend you do this, but if you took a cord and wrapped it around your forearm and completely cut off all blood flow to your left hand, you would have a matter of hours to restore that, and no damage, no permanent damage would occur. Your hand and the muscles and the tendons and the ligaments and the bones, they do require oxygen, they do require blood to be flowing through them, but the demand is very different because they are not using energy at the same pace that your brain does. Those parts of your body also have some degree of being able to store oxygen so that when high demand comes along, you're able to do that and not have adverse impact or effect of it. So if you cut off all blood flow to your hand, you've got several hours to restore it. Now, on the other hand, if you cut off blood flow to any part of your brain, within a matter of minutes, that reacts. Actually, within a matter of seconds, it starts running out of energy to the point that it can no longer communicate. If that blood flow is not restored within somewhere between 4 to 6 minutes, those cells may very well go into what's called apoptosis, or programmed cell death. So cells within the brain are exquisitely sensitive to a lack of oxygen, and as a result, they will start to shut down and die very, very quickly if they are deprived of oxygen and if that oxygen is not restored. Now, again, this is what happens in a stroke. Is a small part of the brain is deprived of oxygen because there's an artery that is either broken or blocked, and so the blood is not able to get downstream where it needs to go. What we're talking about, though, with an anoxic or hypoxic injury is a global impact on the brain, because it's not just one artery, it's the entire circulation or flow of blood to the brain. Now, there's different parts of the brain that use energy at different paces, at different rates. As a neuron fires, as it sends a signal, it uses energy, and it's constantly having to resupply that energy by using oxygen as a catalyst for the substances in your bloodstream that it uses as fuel. That would be carbohydrates, fats, and proteins. Those are all consumed as reactants. So that's the fuel that is necessary, and oxygen must be present for that to occur. In the same way that a candle requires both fuel as well as oxygen. If you shut the oxygen off, the flame goes out very, very quickly. Within your brain, within the neurons of your brain, if you shut the oxygen off to it, the mitochondria are not getting the oxygen that they need. They cannot produce the fuel that is necessary to run that cell, and that cell will stop sending the signal relatively quickly. Mitochondria convert the fuel and the oxygen into something called ATP. This is the energy substance that makes things happen in brain cells. If you run out of ATP, the neuron doesn't have the energy needed to open and close the ion channels to make the propagation of that action potential go down the axon. And so as a result, the neurotransmitters can't be released, the cells can't do what they do, and the brain won't do what it's designed to do. There are parts of your brain that are always firing, that are constantly working, and there are other parts that only come on, they only light up, they only send signals when they need to. So physically, cognitively, if you're engaging in a certain task, it is necessary for certain localized functions in your brain to fire. Now, we've talked often about the motor strip in the brain, and that's an easy one to see because there's a physical correlation between the firing of part of your left motor strip and some movement of the muscles on the right side of your body. Like an engine in your car, provided the engine is working, it needs a steady supply of fuel. Now, if you turn off at the fuel pump in the gas tank the fuel supply to your engine, it has a very limited amount of fuel in the pipeline. And if that engine is just sitting at idle, then it's going to run for a little while and then it's going to stop. On the other hand, if that engine is redlining, if it is revving, it's going to run out of fuel much more quickly. Within the brain, there are some cells that are always firing. They are constantly working. They never stop. Things of which you are not consciously aware necessarily. Cells that fire that regulate your pulse rate, that regulate your breathing, things responsible for memory function. A couple of regions deep within the midbrain called the hippocampus. These are working even while you're asleep. When you wake up in the morning and you remember what you have been dreaming about while you were asleep, it's because there's a part of your brain that's invested in transferring things into memory that has been working. So even when you are not consciously aware of the fact that your brain is working, there's a part of your brain that is recording some of that information. It is likely that you all have at some point in your life had a dream that you still remember having at this point. But at the time that you had that dream, you were effectively unconscious and unreactive to what was going on around you. But that part of your brain's always working. And so because it is one of those redlining areas, it's always firing, it's always working, it makes sense that if you deprive the brain as a whole of oxygen, that area is going to take a big hit. And so the hippocampus is something that in almost any kind of brain injury, but especially in an anoxic injury, it takes a big hit. And so that's one of the areas that starts running out of fuel first. And again, if that blood flow is not restored within 4 to 6 minutes, those active cells can no longer produce energy. They go into a cellular death and eventually decomposition if that is not restored with further energy stores. All right, now we're going to emerge out of the weeds and start getting into what you expected me to talk about, which is how do people get this type of injury? So what happens? What are the mechanisms of this injury? From the standpoint of the damage that occurs to the brain in the absence of oxygen, there are kind of 4 major classifications. You'll notice I've got 5 of them here. The second one, respiratory arrest, is actually a subset of stagnant anoxia, but there are some important pieces that I want to break that one out just a little bit. There are some overlaps here with the damage that occurs as a result of a stroke. Again, a stroke is a localized loss of blood flow and resultant damage to cells secondary to a loss of oxygen. Whereas in a stroke, anywhere from a pinpoint tiny artery to a major blood supply that involves close to a quarter of the brain's volume may be impacted by that loss of blood flow. Well, that area that's affected by the loss of blood flow, we call that an infarction. That's an area that is compromised secondary to a loss of oxygen. These mechanisms of injury in the case of an anoxic or hypoxic injury represent a global threat to the brain. The brain as a whole is exposed to decreased levels of oxygenation. The severity of the effect reflects the amount of tissue exposed to the loss and the amount of time that cells go without the needed oxygen. From a functional standpoint, your brain's activity is reflected in your ability to move, to think, to maintain consciousness. So when those cells stop firing and the brain is not doing what it's able to do, you lose those abilities. So someone who is deprived of oxygen for a period of time will lose consciousness because those cells are no longer firing. The speed at which that happens is representative of how quickly the cells have run out of energy and stop sending a signal. Now, most of the time people, there's a lot of video, there's a lot of TV, there's a lot of movies that grossly misrepresents how the human body actually reacts to a variety of things, including injuries. Most superheroes wouldn't make it through a movie. You'd need 5 or 6 of them to get from the beginning of the movie to the end because they wouldn't survive a lot of the injuries that they're able to somehow get up and walk away from. Same thing from the standpoint of how quickly we lose consciousness when our brain is deprived of oxygen. In most movies or TV shows, somebody runs up and they'll grab somebody by the throat and they're choking them out, and the person who's being choked is fighting, and after probably a minute and a half, they finally break free and win the battle. Well, in truth, at normal room temperature, if somebody was to walk up behind you and completely close off your airway, you have approximately 10 to 15 seconds of consciousness. That doesn't make for a very good movie, doesn't make for a very good fight scene, and so Hollywood has kind of altered that a little bit. But the expectation of most people is that you can, because you can hold your breath for a minute or two pretty easily, then you should be able to maintain consciousness. But you have to remember that when you hold your breath, you're actually preparing for that. You're taking several deep breaths. You're hyperoxygenating the blood flow so that you've got extra oxygen in your blood that is circulating. If you don't plan for that, if you don't know that that's coming, you're going to lose consciousness relatively quickly. Now, the first cause that we're going to talk about here is stagnant anoxia. Stagnant in this case refers to interrupting the flow of the blood within the body or the air in and out of the lungs. So stagnant anoxia is also called ischemic anoxia or hypoischemic anoxia. So anything that interrupts the blood flow or the oxygen flow is within this realm. According to a 1989 study, anesthesia accidents at that time and cardiovascular disease each accounted for about a third of all cardiac arrests. So if your heart stops beating, then your blood is not circulating. So as a result, it is not reoxygenating in your lungs, and that is a stagnant condition of blood flow. So anything that stops your heart. So of the things that we listed right there, myocardial infarction, if it's a massive heart attack, then your heart is not going to be circulating your blood. Another one, chest trauma, and I've seen this one numerous times working in this facility where we have someone who has an injury as a result of a chest trauma. So a large door, a large pillar, something heavy falls on a person. That chest trauma results in an inability of the body to continue circulating blood. Electrocution, the means by which electrocution typically causes brain injury is it stops the heart. In stopping the heart, it stops the blood flow to the brain. So that is a cause of anoxic injury as well. Other causes of cardiac arrest can include asphyxia. So in other words, if you block the ability of air to get into the lungs, then you have a limited amount of oxygen that is in there, and pretty quickly you're going to run out of that. So asphyxia is most often associated with cardiac arrest associated with asphyxia is most often associated with suicide attempts or by near drowning or by choking. So again, these are, it can be something that an individual does intentionally, or it can most often be an unintentional injury. So choking is a blocking of an airway. When it comes to choking incidents, actually, children are very much at risk for choking incidents. Between the ages of 1 and 4, that's the leading cause of death for children. And when it comes to near drowning incidents in the United States, the statistics show about 10 people per day drown. 2 of those would typically be children. Some of those, again, are going to be choking incidents associated with suicide attempts, either by near drowning or by attempted hanging, either of which can cause a blockage of the airway. So basically about a third from what we know of cardiac arrest issues, about 30% of those are secondary to cardiovascular disease of all asphyxia incidents. Another 30 or so are secondary to anesthesia complications, and that's high when you think about it. But again, in a surgical procedure, you're typically suppressing respiration to some degree, and in doing so, that can also cause anoxic injury. Chest trauma makes up only about 10%, asphyxia is about 16%. It is a restriction of blood flow to the brain as well. Then this is an important point. After a traumatic brain injury, swelling often accompanies those physical injuries to the brain. And so as a result, a restriction of blood flow in the brain can be a secondary process after a severe TBI. The swelling, the inflammation of the tissues secondary, which causes increased intracranial pressure, restricts or constricts blood flow. The physical swelling of tissue decreases arterial volume. If you have more brain tissue because it's swelling, it's going to be pushing on those fluid aspects. So first thing that takes a hit is cerebral spinal fluid volume is reduced around the brain because of swelling. But the second thing that typically occurs is the arterial volume is decreased. You don't have as much flow of arterial blood through the brain, and so as a result, there is a decreased oxygen perfusion at a time in which the brain needs oxygen more so than ever. You can also increase ventricular volume. So in other words, if something is blocking the flow of the ventricular flow of volume of fluid, it will cause a swelling. So that hydrocephalus deep within the brain, as the ventricles enlarge, will also put pressure on brain tissue, and that is also a way by which blood flow can be constricted or oxygen perfusion to the brain can be reduced as a secondary process after a traumatic injury. Respiratory depression or respiratory suppression is a subset of that stagnant anoxia, but I did want to break this one out because this is one, particularly the first one listed, opiate or opioid overdoses, is one that has dramatically increased within the last decade. A suppression or cessation of breathing results in low oxygen levels and high carbon dioxide levels within the blood, and the severity of potential damage is really dependent upon the degree of suppression, or in the case of an arrest, the amount of time that the interruption of blood flow is caused. Such suppression doesn't typically result in brain changes except in more severe cases when it comes to respiratory suppression. In long-standing cases, as may be encountered in sleep apnea, you can get a cumulative effect of those continued hypoxic events. If it advances to the point of a life-threatening issue, it can be a primary cause of cellular death within the brain, which is a global issue. Even relatively mild suppressions of oxygen levels within the blood, like I said, that can be encountered in cases of sleep apnea, you can see cognitive effects such as memory loss and decreased attention as potential effects of those types of issues. So in the case where someone is referred, for example, for a neuropsychological evaluation to look at cognitive functioning to evaluate for the potential of dementia, you also often have to rule out obstructive sleep apnea as a potential cause of memory deficits because it can be a direct effect of those repeated hypoxic issues. In anoxic anoxia, it refers to the fact that there is not oxygen sufficient present within the environment itself to support continued life. You will typically encounter a reduced amount of oxygen at higher altitudes, and so if you've ever heard of altitude sickness, this would be an effect of that. So I can remember one time in Colorado visiting there, and I was raised in Louisiana, so we were relatively low altitude. We went to Colorado and went up on top of Pikes Peak, up the Cog Railway. And my dad got out and ran around a little bit and was having a good time out in the snow, and then got really dizzy and lightheaded and developed a headache, and that's called altitude sickness. He was not getting enough oxygen for what his body was used to. Now, if you lived in Colorado Springs, if you spent a lot of time up on top of Pikes Peak, your body would actually produce more red blood cells. Remember I said earlier that the hormone within your body that regulates that can change that. So you would have more red blood cells than somebody who lived at a much lower altitude, and as a result, you have much more efficient oxygen utilization. They actually train pilots, particularly military pilots, to react quickly and automatically to an explosive decompression. If you are at 40,000 feet, if you've ever flown on a plane, you have been given instructions on what to do if the little masks drop down in front of you, and that the situation that would create that is typically a decompression of the aircraft. So at the altitude that large jets fly, there's not enough oxygen for you to maintain consciousness. And so as a result, you have to artificially introduce oxygen. You have to put on a mask and have oxygen flow through that. And when they tell you, if that mask drops down, put it on your face immediately. Remember, if you have an unplanned loss of oxygen, you've got about 10 or 15 seconds of consciousness. You don't have 2 or 3 minutes to figure out what to do. So that's why they tell you, put your mask on, and if you need to help your kids or if you need to help someone else around you, put your mask on first, because if you are unconscious, you're not going to be of assistance to anybody. It is not an automatic thing to stick a mask on. Even fighter pilots have to be trained to do this automatically, because when they put them in a room that they are capable of sucking all the oxygen out of that room, and they tell them, okay, get ready, they flip a switch and all of a sudden they've sucked all the oxygen out of the room. And if these guys don't put on a mask really, really quickly, then they get oxygen starvation. And with oxygen starvation, you get decreased reaction time, impaired judgment, and one interesting aspect, euphoria. So your anxiety level actually goes down. So you're at much more risk of dying as a result of a lack of oxygen because you're not reacting to it, and you start to lose focus on why it's important to react. So you have to train with that. You have to do that multiple times so that it becomes an automatic reaction when you encounter that situation. For the vast majority of us, if we ever encounter that, it's going to be the first time we've encountered it. And so reacting quickly is something that is probably not going to be automatic for me or for you because we haven't trained to do that. Another possible cause of anoxic injury is one of toxic anoxia or histotoxic anoxia. This is where oxygen is present and our circulatory system is moving red blood cells around in our body, but because of chemical reasons, oxygen is not capable of binding to the red blood cells. Now, the most common of these is carbon monoxide poisoning. In the developed world, where we tend to, particularly in this part of the country, leave our cars inside the house, we're at much more risk of this. In part because now the bigger thing really is anybody in the wintertime is at greater risk for carbon monoxide poisoning because you tend to run your furnace a lot more. The hot water heater is going to be running a lot more. And if those are gas operated, you have to vent that carbon monoxide out of the house. So you've got a big exhaust that takes that carbon monoxide out of your house. If that is leaking, then you can get lower levels. And again, it's not necessarily an overwhelming issue. It could be repeated hypoxic events as a result of ongoing carbon monoxide poisoning. Now, the problem with the low levels of carbon monoxide that would be picked up by a carbon monoxide detector if someone had one is that it creates a situation where you get headaches, you get nausea, you get fatigue. People tend to interpret that as symptoms of the flu, or they think they're just kind of fatigued. They're not feeling well, when in fact it could be carbon monoxide exposure. The winter is when you also tend to have the doors and windows locked up tight, and so your house is pretty well sealed. And so carbon monoxide leaking from your hot water heater exhaust might not be an issue in the summertime because you've got a little bit more ventilation going on in the house. So it is something that the leading cause of accidental poisoning deaths in the United States is that of carbon monoxide poisoning. Another one that is probably a little bit more recent is that automatic car starters are now available. So you can push a button on your key fob and start your car. And if you thought that your car was sitting outside the garage, but it's actually inside, you can expose yourself to very high levels of carbon monoxide. There was a case that I remember here in Omaha a couple of years ago where someone had come home from the grocery store and left the car running, didn't realize that it was running. Cars can be quiet, and they unloaded their groceries and took them upstairs, and on the last pass hit the button and shut the garage door, and actually died of carbon monoxide poisoning because of that car running in the garage that they didn't realize was there. So this is a unique risk. There are other things such as cyanide poisoning that also interfere. What happens there is carbon monoxide preferentially binds to the iron atoms in hemoglobin. So basically they bind and don't let go. We don't have an exchange system to get rid of carbon monoxide built into our body very well. It's not as efficient as CO2 exchange. So as a result, oxygen that is present within the lungs cannot get to the red blood cell. It cannot connect, cannot bond. Therefore, it cannot be carried throughout the body. So that is a reduced amount of oxygen secondary to that process. Anemic anoxia is where the blood cannot carry sufficient oxygen to the brain. It can be for a variety of factors. One would be simple blood loss. If you have a massive amount of blood loss as a result of an injury, you don't have enough blood in your circulatory system to carry blood where it needs to go. Anemia can also be a secondary process from a lack of red blood cell production. Remember, I said earlier that you have hormones that affect your kidneys, and as a result, that can impact the red blood cells within your body. Various lung diseases that interfere with the lungs' ability ability to oxygenate your blood are also factors that can result in damage as a result. Now, I'm not going to expect you to memorize this or answer a question on the basis of it. This is really just something to demonstrate the complexity of the energy cycle within a human cell. And if you see on the 7 o'clock or so position, something called apoptosis. Apoptosis is the process of programmed cell death. Now, this is different than necrosis. Necrosis is when a cell is damaged through trauma or injury or toxins, and then breaks down and dies. Apoptosis, on the other hand, is chemical signals within the cell that tell the cell it is time to die. So remember earlier, I said you have all these red blood cells circulating, and they last about 120 days on average. At the end of their life cycle, the chemical capsase 9 actually tells the cell it is time to die, break down, and be reclaimed. So in essence, that process, when it's natural and orderly, is a disposable of cellular debris, and it's handled effectively and no harm is done. It's essential, the fact that the process continues on a daily basis. As an adult human, you lose somewhere between 50 to 70 billion cells throughout your entire body per day due to apoptosis. In a year, this amounts to a proliferation and destruction of a mass of cells that is equal to between 75% to 100% of your body weight. So that number of cells in a year is replaced. Now think of what would happen if you didn't have apoptosis. We would get really big if we lived a long time because you'd be doubling your body weight every year. We call this homeostasis. We replace what goes away. We continually replenish the body. When it occurs in a large and disorderly fashion, such as because of trauma, or in the case of what we're talking about, a lack of oxygen to part of the body, we call that process necrosis, as those cells break down and begin to become toxic to the cells around them. So it's not only a primary process if you lose brain cells as a result of an anoxic event, those cells are going to break down and become toxic to the ones around them. So there are secondary processes that occur. And again, the breakdown, the shutdown of a cell's function and the activation of apoptosis typically happens around 5 to 6 minutes without oxygen. So if the cell is not constantly given a supply of oxygen, that happens relatively quickly. If reperfusion occurs, you can also have, after a period of ischemia, results of inflammation and oxidative damage that results in oxidative stress. So in other words, you get leukocytes that get built up in the small capillaries and obstruct them. And then the chemical process associated with ATP metabolism creates radical reactive bonds. When you return oxygen, these form very aggressive and damaging compounds. And so there are secondary processes that are biochemical in nature when cells are damaged as a result of a lack of oxygen. And even the restoration of oxygen to those cells can cause damage to the cells or damage to the cells around them. It's like throwing gas on a fire after you've had that loss of oxygen. Symptoms that are typically associated, the progress and process and progression of symptoms with something global like anoxia typically has a relatively rapid onset and can have rapid, severe consequences. It's like a stroke, but the whole body is affected and impacted. The initial presentation is an alteration or loss of consciousness. For hypoxia, as opposed to anoxia, if it's anoxic, if there's no oxygen available, the reaction is going to be relatively quick and relatively global. For hypoxia, on the other hand, it's typically a slower onset because it's not a complete loss of oxygen, it's just a reduced amount. So symptoms typically come on more slowly, and the rapidity of the onset of those symptoms is directly correlated with the amount of loss of oxygen, the amount of hypoxia. So you can have, like I said, issues that occur over a number of days, weeks, or even months that have a cumulative effect. With an anoxic insult, it has a relatively immediate effect. Within a matter of seconds to minutes, unconsciousness and damage can occur. The prognosis really depends upon the amount of brain tissue issued and the mechanism of injury. Those two combine to make prognosis a difficult prospect after injury. Like all brain injury, the effects can be mild or even transient in nature, or moderate or severe. Again, a transient effect. I'm eating a hot dog, I start choking on a hot dog. My oxygen is cut off. You see me grasping at my throat, you perform a Heimlich maneuver, transient issue is resolved with no injury. Without intervention, that sets in place a cascade of events that will lead to severe injury or even death in a relatively short period of time. So if you had not gotten that hot dog out of my throat, Tim, I would not be around for very long. If it's caused by an overdose, detoxification is often the necessary immediate treatment, often using medications that work against the effect of whatever is suppressing respiration. Now, naloxone, methadone, Suboxone, these are medications that work against opiates. They are opiate antagonists. Narcan is one you might have heard of. It's a commercial name for naloxone. And if you watch Live PD or Cops or any of these types of shows, you may have seen a situation where they've administered Narcan to an opiate overdose victim. The result is a complete reversal of those overdose symptoms in a matter of minutes. What Narcan does is it binds to opiate receptors without activating them, and so someone goes from minimally conscious or unconscious to awake, alert, and in some cases even aggressive, because the symptoms of that overdose are almost immediately reversed. Severe anoxic injury can result in death. It can result in persistent coma or recovery only to a persistent vegetative state, a term in which an individual is awake but unaware. In a vegetative state, an individual has established sleep-wake cycles, eyes open for prolonged periods, but in a vegetative state, there's no evidence of any consciousness on physical examination. Persistent vegetative state, it's considered persistent or permanent after 3 months post-injury if it's an anoxic injury, typically after 12 months if it's a traumatic injury. Meaningful recovery after such time is relatively rare, but can occur. Minimally conscious state involves a severely altered consciousness in which minimal but definite sustained or reproducible behavioral evidence of awareness of self or environment can be demonstrated. So in other words, an individual in a minimally conscious state may have times when they can communicate or even respond to basic commands. And this can be a stage of recovery, or it can be a permanent state. As brain cells are so exquisitely sensitive to a lack of oxygen, permanent cellular loss in an area of the brain reduces chances of functional recovery of that ability that is supported by that part of the brain. With a moderate acquired brain injury or anoxic brain injury, there's a better prognosis and outcome than severe. There's a higher survivability to begin with, but there are also greater chances of residual deficits that may take months, years, or may never fully resolve. So protection of the tissue after the injury has occurred is the next phase. That can be things like cooling the brain via cooling the blood in the bloodstream, although more recent evidence has suggested that this is not as effective as was previously thought. Use of steroids to reduce brain swelling and inflammation. Craniectomy, as I mentioned earlier, if the brain is swelling to reduce pressure, taking off part of the skull is sometimes necessary. And proactively treating this increased seizure risk that occurs during this phase of injury and recovery as well. Longer-term chronic aspects is looking at the process of recovery and rehabilitation. This can involve speech therapist, physical therapist, OT, whatever is needed for the specific symptoms with which a patient presents. Some symptoms are a lot more common with individuals who have sustained this type of injury. So let's talk a little bit about what type of symptoms are relatively common. From a cognitive standpoint, deficits that are very common, first of all, would be incorporation of new information. As I said earlier, the hippocampus, which is a part of the brain that is critically involved with getting information from our immediate working memory and attention into our long-term storage, if that is not working very well, then you're not going to hold on to new information. So again, it's like I've talked about with brain injury. You don't forget everything you've ever known. That information is in there. However, getting new information transferred into long-term storage requires that that part of the brain be working. And that part of the brain takes a huge hit when you have a lack of oxygen. You can also have deficits of executive functioning, which include judgment, impulse control, reasoning, processing of information. Divided attention and speed of processing are also very commonly impacted. So an individual after a severe anoxic injury is going to typically have memory deficits that are profound. They are also going to present with slowed processing speed and a generalized slowing across the brain. You can see language disturbances that also tend to be more frontal in nature, such as difficulty retrieving specific words, naming specific objects, or substitutions of words, or making up new words when you're trying to say something that we call a paraphasia. I know the word that I'm trying to produce, but I've come up with something that's kind of in the ballpark, but not exactly what it is that I wanted to say. Typically, in more severe cases, you can have disruptions of visual acuity, kind of fuzzy looking vision may be present, or visual disturbance that are more based on neuromuscular control. So in other words, ataxic muscle movements that result in disruption of vision. Much more rare, but potentially an effect of anoxic injury is cortical blindness. In other words, damage to the occipital lobe, which results from an anoxic injury. The brain is no longer able to process the information coming from the retinas. Therefore, the person does not have vision. I have seen that in a couple of cases from anoxic injury secondary to intentional overdose. If parietal damage is incurred, an individual may not be aware of the fact that they are blind. They may very well confabulate vision secondary to an unawareness, an inaccurate awareness of the deficits that exist. Physical deficits commonly encountered would be ataxia would be the largest one. So a disruption of muscle movement, uncoordinated cogwheel type of movement, difficulty carrying out sequences of motor movements. And like I said, even affecting things like swallowing, vocal quality, vision. Those are all based on muscles firing in the correct sequence and smoothly. And so weakness or loss of functioning as a result can be present. Common psychological deficits include a number of different aspects. Depression in particular, probably twofold. One would be secondary to changes in the balance or in the production or in the utilization of neurotransmitters that are involved in mood, as well as for individuals who have awareness of deficits that exist after injury, the awareness of those deficits and the impact of those deficits on their life. That is why after almost any type of injury that results in deficits, individuals have increased rates of depression post-injury. Personality changes are typically more reflected in frontal or executive dysfunction, such as impulse control issues, a loss of kind of filter between what you think and what you say, a loss of emotional or behavioral regulation. That would be more associated with frontal executive deficits following injury. And with a severe enough injury, you can have patently psychotic symptoms that may exist. There's a little overlap here, however, with medication effects, and so you have to be cautious of that. Medication effects are much more likely to cause these types of symptoms. And so if an individual is presenting with overtly delusional or overtly psychotic symptoms or hallucinating after an injury, while it is potentially a direct cause of the neurological insult, it's also much more likely to be a secondary effect for medications that are being given for some other aspect of functioning. Medications that are typically given for Parkinsonian type symptoms or ataxic type symptoms often increase the production and utilization of dopamine within the brain, which is one of the primary neurotransmitters that are involved in many of the psychotic disorders. Now, because this is an unplanned and unintended injury in most cases, prevention tends to be broad and aimed at education of the primary risks that all of us are exposed to minimize the likelihood of being injured in the first place. So from the standpoint of choking being a relatively large hazard, eliminating those choking hazards. If you have a little one at home, you know this because you've already had to go through the process of trying to childproof your house, part of which includes putting things that are capable of choking a child, including, making sure that the toys are not choke hazards, things that could otherwise block the airway. And for us adults that go out and order a big steak, remember to chew your food slowly and carefully. Don't try to swallow too much at once. That's why Heimlich maneuvers are occasionally needed in restaurants because somebody has stuffed a little bit too much food in there too fast. Learning CPR and learning rescue is an important aspect of being able to jump in and, like I said, prevent the cascade of events that can result in severe injury or death. If you can intervene at that point before it ever becomes a brain injury, that is ideal. Installing carbon monoxide detectors in your home. If you have potential sources in your home, if you have gas heating, if you have a gas water heater, if you have a car that you park in your garage, you need to have a carbon monoxide detector in your home, and you need to change the batteries every year. Um, Learn how to swim and supervise children closely around water. Again, drowning is a relatively high risk for children. And so if you look at being able to swim and teaching others to swim, that minimizes the risk when it comes to those drowning deaths that we talked about earlier. Avoiding alcohol and drug abuse and being aware of potential interactions of drugs. Many drugs, such as opiates with alcohol, have a multiplicative effect. And so as a result, that suppression of respiration, which could exist with either of these substances, goes dramatically up when you combine the two of them. And then, like everything else in life, just maintaining a general healthy lifestyle. If your heart is in better shape, then you're not going to be at greater risk for a heart attack. And you're not going to be at greater risk for having an anoxic injury because of a stagnant incident associated with a heart attack. So going to your doctor on a regular basis, maintaining an active lifestyle, moderation in all things, and all of that would be the bottom line for how to do your best to prevent these unintended injuries that can result in anoxic damage to the brain. So that pretty well wraps up the presentation that I had for today.